Hey, I hope you guys are having a great day. Welcome back to my channel. Thank you for joining me today. Let's talk today about something that a lot of women choose to use for pain relief during their labor and delivery birth. And that is something called an epidural. It is an option for pain management that can help decrease your pain during delivery. Now, is an epidural going to 100% take away your pain? It is not guaranteed to take away 100% of your pain. There are women that do get 100% pain relief, but if you can get, up to 90% of relief, it might be well worth it. But first, I'm Shannon. I'm a certified nurse midwife, and I have been taking care of women in labor and delivery and in midwifery for the past 24 years. So without further ado, let's talk about this epidural. First, let's talk about what an epidural is. An epidural is numbing medication that is given to you in your spine to help decrease pain and the nerve response to the pain during contractions of your labor. Now, this does not go into the spinal cord. It goes into the epidural space that surrounds the spinal cord. So that's a common misconception, is that the epidural goes into the spinal cord. Now, question number 2. Who is a candidate for a labor epidural? Most women will be a candidate for an epidural during their labor and delivery, and that is going to be per policy and procedure of each facility, of each anesthesiologist or anesthesia group that is going to be providing the medication. Now, certain women with medical conditions, one big one being low platelets, may not be a candidate for an epidural because of increased chances for bleeding. Question number 3, how is an epidural actually done? First of all, the anesthesiologist and the nurse or provider will help get the patient positioned so that the anesthesiologist can feel the spine and feel in between the vertebrae and the spaces. Then once that is done, the area is then cleaned with an antiseptic solution that helps to prevent infection. And then the anesthesiologist will insert the needle into the epidural space and find that small area between the vertebrae. It's the epidural catheter, and which is kind of like IV, miniature sterilized IV tubing that would be connected to your IV while you're in labor. Then they remove the needle and they take the epidural catheter up and they lay you down, get you positioned, and then they hook your epidural up to a pump that will have medication infusing into it continuously. Question number 4. How long will my epidural last? Your epidural should last your entire labor. Depending on how long it lasts, you may need some redoses or top-offs. You'll hear it referred to in different ways at different facilities. Question number 5. How long after I deliver my baby will it take for the epidural to wear off? Usually the average time frame is between 1 to 2 hours for the epidural to actually wear off, where you could physically stand up and support your body weight without an increased risk of falling. Now, also a lot of women are concerned about risks. One thing I tell patients, there is nothing that man, human, provider, midwife, nurse, there's nothing that we can do to you that is 100% without risk. You just have to weigh risks and benefits and do what you feel is right for your body. But major risks with an epidural: risk for infection, risk for potential long-term back pain after delivery. That time frame is different for every woman. You have an increased risk of, while you're getting the epidural done and getting the medication, that your blood pressure could drop. This could adversely affect the baby's heart rate, causing the baby's heart rate to drop, which usually is corrected fairly quickly with IV fluids, position changes, and medication that you can get that will help to increase your blood pressure. Now, another risk is that when anesthesia puts the medication in, that instead of the medication going from the lower back down the legs, that it goes up, which could affect your breathing and can make it difficult to breathe, causing you to need some breathing support.